The South London Mental Health and Community Partnership is a partnership between the 3 mental health and community trusts. I say community because Oxley's also provides community services to their 3 boroughs that collectively provide services to the residents of South London. And the reason that we have come together as a partnership is really very simple. We want to drive value for the residents of South London, and by value I mean we want to deliver the highest possible quality of outcomes for every South London pound that we have to spend.
All 3 organisations are facing similar challenges at the moment, and so the conversations we've had is to say, are we better off going it alone, or are we better off talking to each other and thinking about how can we support each other meet some of those challenges. And even now, just a few months in, we've seen some real benefits to our patients in South London. And this is such an opportunity to think about, are there things that happen in SLAM that we could do in Oxley's better? Are there things in South West London St George's, like the work you've been doing particularly around bed occupancy? We found it really interesting to learn from you. And it's about how do we share some of that together for the absolute maximum benefit of our patients, but also to see if we can do things more efficiently, because we are all facing significant financial challenges.
It isn't a merger, and I have heard that people say that this is just going to be a merger, but we're absolutely clear, and our boards have been clear that this is not a merger. This is us working together, as Matthew says, in a partnership across South London, of where we can learn from each other, where we can share things. We will remain 3 organisations.
Absolute priorities around how can we deliver better patient care to our local populations within the resources available. And a really good example of some things we've already achieved is around our forensic services, where we are one of the new models of care. We're working together across the 3 trusts to redesign the patient pathways, and we've already repatriated over 20 patients who had been receiving care and treatment miles away from their local area back into South London. And we're thinking about how can we create a much better service for those patients and making sure that they are being treated in the most appropriate setting all the way through their journey.
One of the real benefits that we've seen is the way that the directors of nursing have started working together and really picking up that challenge. So we've all got lots of vacancies. We know that there aren't the nurses out there that we need. We're going to have to do some things differently. So we've got a grant of around £800,000 from Health Education England that's looking at how can we develop unregistered staff, give them a career pathway, look at attractive jobs for them to recruit into, that helps to fill some of the gaps that we've got, but also for our registered staff, giving them more opportunities across the patch, across 3 trusts.
It's about having really explicit permission to all of our staff to pick up the phone, to talk to each other. We are facing similar challenges, and why not just see how other people are tackling these things? And it's absolutely fine for people to pick up the phone and engage with colleagues from the other trusts and see, are there things we could do differently, and learn and share.
I think it is very important that mental health has a clear, coordinated and audible voice in the health debate. It's very easy for, particularly at times of stress, for the mental health perspective to be lost, and actually mental health is a part of the solution to the challenges that the NHS faces at the moment.
It hasn't been able to get on and you say, and joke and not be precious around things.
And I think we would like to see that replicated across the staff of our organisations. As you were saying earlier, Ben, just to pick up the phone, ask a quick question of a colleague. It doesn't matter if they happen to work for SLAM or for South West London and St George's. We are actually all colleagues trying to deliver the same ends. And we have complementary strengths. So So David's the smart one, Ben's the good-looking one, and I'm the old one. So as a partnership, we are very driven by quality and the quality of outcomes that we can support. I think it's no surprise to anybody that all NHS organisations have been under tremendous cost pressure in recent years. I don't actually think that the answer to that is continued cycles of annual cost improvement programmes. Actually, I think the answer to that is continual cycles of clinically led, clinically driven quality improvement, so that you're doing the right thing at the right time, in the right place, where the person in need is meeting the right professional. And that's all about the QI agenda, the quality improvement agenda. And I think it's that that's going to deliver genuine sustainability. And if we can do that at scale across 3 organisations, actually the potential power for maximising the value of the money we have at our disposal is greatly enhanced.
So if you think about when we go out to negotiate contracts with suppliers, if we do that together, we're likely to get a much better price than if we're just doing it as 3 organisations separately.
We know that a lot of our staff know each other, a lot of them trained with each other, but where you'll see the real benefits is people challenging each other to how can we improve practice. And I think we've seen that with the forensic pilot that we've done, and that staff from across all 3 trusts have got together, and they're holding each other to account on what happens in a patient pathway, how do we design the best pathway, and then make sure that we stick to that. And I think that's the way that it will happen. It's, as Matthew said, it's not an imposition of we'll say this is the protocol. Clinicians develop that. That's the way you'll get buy-in, and that's when you get the real benefits.
I think this is a time of great anxiety in the NHS though as well, and I think that between the 3 of us, if people will work flexibly with us, what we can offer them is security in terms of employment, and massive opportunity to gain a whole breadth of experience across the 3 organisations.
Yeah, absolutely. And I think we looked at where staff live. We know the majority of people live in South London, and so opportunities like that. Something may there may be something finishing in one organisation, but there's lots of opportunities in one of the other 2 organisations, and we should be able to offer that to our staff. I think this is a model that others will copy. So we've already lots of interest from our other colleagues in London around how this is working, what's the tricks to make it working. So I think you'll see this as a model of how trusts collaborate in the future.